Have you ever been accused of sawing logs while you sleep? Do you sometimes wake up maybe more tired than whenever you went to bed? Stay tuned to learn more on this episode of Inspire Iredell.
Welcome to Inspire Iredell. I'm Megan.
I'm Anna.
We are so glad to have Dr. Jeffrey Brink here with us today. Welcome, Dr. Brink.
Thank you.
So Dr. Brink is a physician at Iredell Ear, Nose, and Throat. He's an animal lover with 3 dogs, 2 horses, and a cat, and loves the Florida Gators and collecting Hot Wheels die-cast cars. How many Hot Wheels do you have?
Estimate about 50,000.
Oh! Whoa, okay, we're going to need to see pictures of this
I was not expecting that. That's amazing.
Wow, 50,000. How long have you been collecting them?
Started back when I was a resident, somewhere around 1992.
Okay.
Honestly, in the
Wow.
grand scheme of things, that's really not that long ago to collect 50,000 of them. That's amazing.
Is that like every Christmas and birthday and things somebody gives you one too?
Well, sometimes.
And you're like, I already have 4 of those.
Basically, there's collector clubs, and you can get the annual box set, which includes over 450 cars. And
Wow.
so I've got every year since 2006 when they came out with those, and of course just bins and bins of other.
Wow.
That's amazing.
Wow.
I bet your grandkids are just like, oh man, let's take these out of the box.
And you're like, don't touch. Oh, man. Fun. What a fun fact.
Yeah. Oh my gosh.
Interesting.
Okay, speaking of interesting, so we always say ENT doctor, but the technical name is How do you actually say that word?
So it's otolaryngologist.
Otolaryngologist.
Some people refer to it as otorhinolaryngologist.
Okay.
I'm literally writing it down, so I kind of remember how to say that. Very cool. Okay, so as an otolaryngologist, which I think that's the first time I've ever said that correctly in my life, what all do you treat? Thank you. What all do you treat?
So we treat all kinds of disorders of the ear, nose, and throat, head and neck, everything from ear infections, throat infections, swallowing problems, thyroid, parathyroid issues.
Oh, I didn't realize that.
Neck masses, nasal and sinus problems, hearing loss, and of course sleep apnea.
Sleep apnea, which we're talking about today.
Yes.
So what made you, okay, here's a curveball question. Not really. What made you decide to want to pursue ENT?
So I thought I was going to be a general surgeon.
Okay.
After I had sort of given up pediatrics due to a bad experience in medical school. And when I got into my clinical rotations, I sort of fell in love with ENT and also liked urology, but decided on ENT because you can do pediatrics and adults.
Yeah.
You have clinic and surgery, and you don't have to undress your patients to examine them.
Very cool.
Very true.
That's a major perk.
Yes. Yes.
Awesome. Okay, so sleep apnea.
Ugh.
Yeah. I was just diagnosed with mild sleep apnea, so this kind of pertains to me a little bit. I mean, like 2 weeks ago, I did an at-home study.
Okay.
So what exactly is it, and how does it affect the body?
So sleep apnea is basically just a sleeping disorder where you pause breathing while sleeping. The adverse effects come to the body because of oxygen deprivation during those pauses.
Okay.
And an increase in strain on the heart, and all the things, medical problems that kind of branch out from that. Cardiovascular is probably the biggest thing. Everything from high blood pressure, heart disease, heart attacks, strokes, and then you have other things, major medical problems like diabetes and depression.
Really?
So those things cause sleep apnea, or they can?
Sleep apnea can cause it.
Wow.
Yeah.
Okay.
I did not realize it could cause something
No.
like diabetes or depression.
Yeah. It
Wow.
can be a serious health problem if untreated.
Yeah.
So you say it's when you're pausing your breathing while you're sleeping. So how significant of a pause are we talking about typically to be diagnosed with even like mild sleep apnea?
So what they do when you do a sleep study is you have an obstruction, which is an event where you're struggling to breathe and you're not able to get the air. And then you have what's called a hypopnea, which is a stop breathing event where you actually inhale and then hold your breath.
Oh.
So both of those are pathological breathing events.
Okay.
And, depending on the study, it's usually about 20 seconds is considered a pathological pause in breathing.
That's a long time,
I know.
especially to be unconscious and doing that.
Well,
I was
when
just
you-
thinking if you held your breath and counted.
Well, think about when you were a kid and you're swimming in the pool and you go, I'm going to swim from this side to that side, and you have to hold your breath that entire time.
Okay.
And then when you come up out of the water, you go,
Yep.
Yeah.
you're doing that while you're sleeping and your body is screaming for oxygen.
Oh my gosh. Wow.
So does it usually with people who have sleep apnea? I'm assuming it's not happening just once while they're asleep that night. It's probably happening repeatedly.
Yeah, and sometimes it can be positional.
Okay.
So if people, get themselves in an adverse position, that may be when they start to snore, or they start to pause breathing, they obstruct. And, some of it is, everything from body habitus. Some people just can't sleep on their sides. They have to sleep on their back. And sometimes the weight can cause serious problems due to the compression of the chest, big necks, collapsing airways. Lots of factors can contribute to why people don't breathe, stop breathe, pause breathe.
Yeah.
Wow.
Yeah. It's funny because my husband actually noticed first that I was stopping breathing.
Okay.
Because I asked him, because I have a habit of falling asleep on the couch watching reality TV. And
There's Anna's fun fact.
there's my fun fact. And I was like, does it sound like that? And he said, yeah. And then my 4-year-old daughter was like, Mommy, I can't watch TV while you're snoring. And I was like, okay, apparently we're having an issue if my 4-year-old is telling me that I'm snoring really loud. So snoring can be one of the symptoms, but snoring isn't always sleep apnea, right?
Yeah, so
Okay.
somewhere around 40% of people who snore have undiagnosed sleep apnea.
Really?
So when people come to me and say, I've got this snoring problem, I start to ask questions as to, do you have other symptoms that would be consistent with sleep apnea? Your daytime sleepiness and fatigue and decreased memory and concentration,
I'm like, check.
irritability, do you wake up gasping for air, choking, those types of things. And,
Have you waked up gasping before?
A couple times.
Yeah?
Mine's very mild, though.
Yeah.
So if they give me some kind of indication, that's when I start to talk to them about, thinking about a sleep study to further pursue and if nothing else, make a diagnosis even if they don't want to treat it.
Yeah. So it's funny because you work all day and you're so exhausted from your sleep apnea, and then you come home and work all night to keep yourself breathing.
You're
So you're just working all the time, working overtime. So I can see why your body would be exhausted if you had this condition. So why do some people develop it and others don't? Are there lifestyle or genetic factors that contribute?
Sure. Men have an increased risk over women.
Okay.
It's
Okay.
about 2 to 3 times greater.
Wow. Okay.
Postmenopausal women, most of those over 50, probably have an increased risk. Pregnant women, increased risk.
Oh. Why?
General population, anybody over 50 at increased risk.
So age is a risk factor.
Age is a risk factor.
Okay.
Underlying already present medical conditions,
Okay.
you know, from cardiovascular to diabetes, previous history of stroke. You have children at risk, and that's usually because they have large tonsils.
Oh.
You have people that have kind of abnormal anatomy, small jaws, large tongues.
So like obstructive sleep apnea would be maybe your tongue getting in the way of breathing?
That is correct. So
Okay.
big tongue, basically what happens is that you have relaxation of the throat muscles when you sleep, and everything sort of collapses and comes together, and you have no airway.
Oh.
Wow.
So I guess elevating would make sense because so your tongue doesn't basically fall into the back of your throat while you're
Yeah.
sleeping.
That is correct.
Okay.
So children, you know, for all the parents out there, what are things that parents should look out for? I mean, I assume, yes, the children being tired or
So-
irritable, but
Correct. The other, excuse me, the other thing that children do is not only do they snore, but they're very restless sleepers if they're trying to get a breath. And parents will come in and say that my child sleeps and it looks like he's trying to, or she's trying to arch their back and open up the airway.
oh,
And that is to increase the space so that they can better move the air.
So your body's kind of subconsciously trying to compensate for that lack of oxygen.
Correct.
Wow.
our bodies are so smart.
They are. But honestly,
Really
if they're
are.
so smart, why can't they just not have sleep apnea?
I know, right?
Why can't
right.
they fix themselves?
Yes.
I guess it's maybe some of the things that we do, you know,
Yeah.
like you were talking about, that can contribute.
Right. Some of the stuff that, you know, people drink alcohol,
Okay.
they take sedatives, they take tranquilizers. That can increase the relaxation of the throat muscles.
Okay.
So when people go to bed, they're already relaxed
Yeah.
to the point where those muscles are going to fail even more.
What about like, I know a lot of people take melatonin before they go to bed.
Yeah, I'm not sure about the effects of melatonin. It's more of a brain type of thing.
Okay.
Okay.
So it's probably has some contribution in that effect. You know, people that take like opioids, like pain medicine, that actually suppresses your respiratory drive.
Oh.
So you basically don't want to breathe because you're just
Floating.
too comfortable.
Yeah.
Wow. Okay.
I had no idea.
I did not know that either.
Oh my gosh. Okay. So we talked a little bit about the risks of leaving it untreated. So, I mean, you're
So the
exhausted.
biggest-
Not breathing.
You're not breathing.
Yeah, so, you know, in effect, if you look at the long-term effects of sleep apnea, it could kill you.
Okay.
But it's not a direct, it's more of an indirect, because what it really does is it creates some serious cardiovascular problems and, you know, high blood pressure, heart failure, large heart syndrome, cardiomyopathy,
Okay.
can lead to early stroke. And then, as we had previously mentioned, type 2 diabetes can be a secondary side effect of sleep apnea.
I never would have thought, like if I had gone into a doctor and said like, oh, I'm having what, and I was diagnosed with any sort of cardiac issue, I would never have tied my sleep to it.
Right.
Like it just, I mean, it makes sense, but I never would have thought that.
And so that's why a lot of cardiologists are very in tuned with, you know, well, your blood pressure is not responding appropriately to medications, or, you know, you've got increased cardiovascular disease. Let's do a sleep study, and they can be a big source of referrals.
Yeah, I was about to say you probably collaborate quite often with cardiologists.
Yeah.
Yeah.
And so I always tell patients, you know, have your heart checked.
Yeah.
And, you know, long term, you do see a increased propensity. People say, can I literally suffocate from sleep apnea? And the answer is, in theory, you could, especially if you're a very large or obese patient. And not only do you have the pressure of the weight on your chest, but, you have thick neck and no airway. And I had a incident with a patient about 10 years ago that weighed over 500 pounds. And she had severe diabetes and ended up with lower extremity amputations on both legs. And she was difficult to move from her house to the hospital and had to have all kind of extra transportation issues. Kept getting intubated, ended up with a trach, and that could be ultimately what happens to people to preserve their airway. They get a tracheostomy tube.
Wow.
Get tested if you think that you have.
So how do you get tested? If you think that, okay, in my mind I'm like, so tell me, how do I get tested?
So sleep studies or polysomnograms are the key to diagnosing somebody. There's all kinds of stuff out there. There's your home sleep studies that come in a box. You have sleep study companies that will come to your house and set up your sleep study.
I did not know that. Wow.
They have things like there's a thing called a ring that you put on, and it literally can tell by the blood flow in your finger. There's another one called.
That sounds easy.
There's another one called a watch pat. You wear a watch and you put a little device on your chest, and it will tell you whether you have sleep apnea. A lot of people want to know a little bit more about snoring, because not all tests include snoring. So I like to do a sleep study that will at least tell patients, how many snores per hour, how loud their snoring is, where it's coming from.
I'm a snorer.
So
yeah,
if they,
me too. Apparently, my 4-year-old says so.
Yeah.
So if you're thinking you have sleep apnea and you're a big time snorer and you do a sleep study and it's negative, then you really would like that additional data to tell you about snoring so that you can make other decisions as to what to do. The unfortunate thing is insurance companies consider snoring to be cosmetic. If you are just a snorer and
because it's so common, I guess.
Well, it's because you're just not a beautiful sleeper.
Oh my!
Gosh, darn it. I'm an ugly sleeper, Dr. Brink. Is that what you're telling me?
Yeah.
That's funny. Oh my gosh. Okay, so if you have the sleep study and you are diagnosed with sleep apnea, what are your options?
Okay, so the gold standard is CPAP, continuous positive airway pressure mechanism. And that's just a now tiny machine, forced air, wear a mask over your nose, over your mouth, or over your face, expand your airway while you sleep so that you can't collapse and you can't obstruct. Okay. So a lot of people are intolerant to CPAP.
Oh.
I did not know that.
So they can't stand the mask on their face.
Okay, I was going to ask intolerant.
They're claustrophobic. They move too much. They're tied to the hose. The hose moves. There's, air leaks. They're waking up their bed partner or whatever. So there are oral appliances that a lot of dental specialists do where you advance the mandible. It's a mandibular advancement device. And some people wake up with very sore jaws because of that. There's tongue retaining devices which sort of pull your tongue down so that it can't fall backwards.
Like your tongue. Okay, I imagine like your tongue on a leash inside of your mouth.
There is one device that you actually create a vacuum effect. You stick your tongue out and stick your tongue through this round device, and it holds your tongue outside your face.
No way.
Okay, I might go back to the office and Google some of these because I'm really curious what they look like.
So,
that's funny.
And then you have your surgical treatments. And, back when I was in my beginning days of practicing, we would do lots of surgical treatment because we didn't know as much about sleep apnea as we do now. So we did some fairly barbaric stuff. We, would do tonsillectomies. We would do something called a UPPP or uvulopalato-pharyngoplasty, which basically is cutting the soft palate and uvula and taking the tonsils out. And
Oh, sounds extreme.
Yeah.
but the problem is there was no addressing of the tongue. So we would do some tongue volume reduction surgery, and that was basically anything from taking a wedge out of the back of the tongue to using radio frequency to create retraction of the tongue muscles. There's a procedure where the bone in your neck called the hyoid is pulled up and suspended to your mandible, so it pulls the back of the tongue with it.
I think I'd rather have my tongue on a leash.
Same.
And then we have now the hypoglossal nerve stimulation therapy, or Inspire.
Okay, yeah.
Okay, yeah, talk about
Yeah, tell me
Inspire, because
about
that's kind of a
Inspire.
fairly new thing. It's not very common in Iredell County. I know
Yeah.
you do it.
So Inspire is an implantation of a pulse generator. It's sort of like placing a pacemaker on the right side of your chest. It basically has a pulmonary probe that detects whether you are creating pressure within the pulmonary cavity, i.e. taking a breath.
Okay.
If you don't create that pressure, take a breath, the generator then stimulates an electrode attached to the nerve that moves your tongue and pushes your tongue out of the way.
That is amazing.
That's really cool.
Yeah, I had no idea how it actually worked. So is everyone a candidate for that?
So, one, you have to be diagnosed with sleep apnea.
Okay.
You have to have an intolerance to CPAP.
Okay.
But an intolerance from an insurance standpoint could be, I got a machine, I took it home, I put it on, I couldn't stand the way it felt, so the next day I boxed it up and took it back.
Okay.
Or it could be a long-term thing. You have to have a recent sleep study within 2 years.
Okay.
You have to have what's called an apnea-hypopnea index, or pathological breathing events per hour, of greater than 15 and less than 100
Okay.
per hour. It used to be 60, but the FDA has recently cleared Inspire to go up to 100 events per hour. You have to have less than 25% central events. Central events are basically sleep apnea events, but it's not an obstruction. It's the brain failing to send a signal to the respiratory muscles to take a breath. So if you have more than 25%, you don't qualify. And you have to have a body mass index less than 40.
Okay.
Wow.
So there's lots of things to go through, so
Correct.
to make sure that you're a candidate for it.
That is
But
correct.
it sounds like an amazing tool, and you don't even have to think about it, or, I mean, you have the surgery. I'm assuming it's, is it a minor surgery?
So the first procedure after you become a candidate is called a drug-induced sleep endoscopy. And what that is basically a brief sleep using propofol, which is an anesthetic, to put you under a sleep condition. And you are scoped through the nose to look to see if you have anterior to posterior collapse of your tongue.
Okay.
If you have greater than 75% circumferential collapse of your airway, then you don't qualify, because Inspire is basically moving the tongue out of the way, and if all of your apnea is due to lateral collapse,
It's not gonna be
it's not
effective.
going to be effective.
Okay.
But the success rate is high. 91% of people who get Inspire say they like it more than they like their CPAP.
Wow.
Okay.
That's
That's a
awesome that
great
there's
number.
so many different options for you if you have sleep apnea. So.
Correct. And a lot of people are wanting to be very conservative, and so some people will go, the dental route. Lots of people are in love with their CPAP.
Yeah.
So
Wow.
it's a viable and good treatment.
Yeah. So are there so outside of medical changes, maybe if you have some mild sleep apnea, what are some things that you could do to manage that?
So, you're talking about lifestyle.
Yeah.
So lifestyle would be, obviously, you'd want to lose weight if you needed to. You're going to want to exercise. You're going to want to think about how you sleep and what position. So positional therapy, if you will.
Would that be like elevating your head?
Or sleeping on your side.
Oh, okay.
Because a lot of people only have problems when they go to back sleeping.
Yeah.
If you're a smoker, you're going to want to quit.
Yeah.
If you drink alcohol, you're going to want to try to avoid it. You're going to want to try to stay away from sedatives, tranquilizers, opioids. And then, some basic things. Some people swear by acupuncture,
Okay.
chiropractic care. Some people say, I drink honey
Okay.
and it cures my apnea and my snoring. Some people think that just humidifying the air in their bedroom while they sleep makes a difference. So lots of things.
So I guess it's just kind of trial and error to see
trial
what
and error.
works for
Wow.
you.
Yeah.
Well, very cool. Well, I think we're almost out of time.
We are, yeah. That
It doesn't
was
feel like
very
it.
informative.
Yeah.
I think I'll be making an appointment.
So, are you accepting new patients, Dr. Brink?
Yes, we are. We are open for business, and we'll look forward to seeing anybody with any ear, nose, and throat problems, including sleep apnea.
Fantastic.
Right.
So, you can find more information about Dr. Brink, about his practice, and what they do there in ENT land at iredelent.org. Thank you. Thank you so much.
Yes, thank you.
No, it's been a pleasure. Thank you for having me.
This has been fantastic. So if you think you should be tested for sleep apnea, talk to your primary care doctor about a referral. And we'll see you on the next episode of Inspire Iredell. Bye, guys.
The content here is for informational and educational purposes only, not for medical advice. Consult your qualified healthcare professional for specific health concerns and questions.